Hi, I'm Dr. Don Bonner with Personalized Wellness. I'd like to welcome you today to this video that we're talking about hormones and weight gain. I've done several of these videos in the past, and actually what I'm doing today is combining several of the videos that I've put out in the past, condense them and put them in one shorter video that hits the bullet points of these topics and makes it just a little easier for you to get all of it in one place. If you haven't watched any of my videos, I'm a board certified functional medicine physician. I'm also fellowship trained in anti-aging and regenerative medicine and metabolic medicine, and I'm also a board certified anesthesiologist also. The other thing, if you notice a little bit of darkness on the side of my nose, I had surgery last week to remove a cancer on the side of my nose, so I'm sorry if that's distracting. Okay, today, hormones and weight gain. A very typical scenario that I have in my clinic is I'll talk to a patient and I'll ask them, what they want to do as far as what are the top things that they would like to improve with their health. And invariably, number one is the fact that they've put on weight and they can't take it off. Their body is different than it used to be. They don't know exactly what to put their finger on as far as why it's changed or how it's changed, but they know it has changed. Because the things that they used to do in the past that worked for them no longer work. And they knew why they were putting on weight, typically. They knew they hadn't been eating very well. They knew they weren't exercising. They put on 10 pounds. They changed a few things around, and then they would lose that weight. But they can't do that anymore. Why is that? And I tell them the main reason why: their hormones have changed, and until we get control of those hormones, they're going to have a very difficult time losing weight. The two particular hormones that I want to focus on today are leptin and insulin. Obviously, there's other hormones involved in weight loss and maintaining your weight, such as thyroid hormone, cortisol, your sex hormones. But the two big ones are leptin and insulin. And the thing that's very interesting about those two hormones are that you have a tremendous amount of control on altering those two hormones by yourself, by changing diet and supplements. And we'll go into how you can do that in just a second. Now, I've done the other videos that I put out. I go really heavy into the physiology of leptin and insulin, so I'm not going to do that today. But what I will say is that I would recommend that everybody have fasting glucose levels drawn once a year, and also get a fasting leptin and a fasting insulin level, because those will tell you whether or not you're able to burn fat. If those numbers are very high, the chances are you're having a very hard time burning fat. Okay, so again, diet and supplements. Again, I shot videos on those, so you can go to my YouTube channel if you want to get more in depth. The take-home point on the diet is that you need to remove several things from your diet I ask my patients for 4 weeks. Give me 4 weeks. The things I ask you to remove are dairy, soy, and wheat, gluten, wheat, and any grains. I want them out of your diet for 4 weeks. The main things I want you to eat, I want you to eat lots and lots of vegetables, especially leafy green vegetables, as much as you can stand. I also want you to have lean meats, organic lean meats, seafood, shellfish. I want you to limit red meat to 1 to 2 servings a week if possible, because I don't want that saturated fat from red meat for that 4-week period of time. Also, as far as your protein goes, I don't want you to eat too much protein. If you go over and above what your body actually needs to build neurotransmitters, muscle and bone, your body just converts that to glucose. So we want to limit the carbohydrates that we take in, especially high glycemic load carbohydrates and that sort of thing for this 4-week period of time. So I usually recommend somewhere between 0.6 to 0.8 grams per kilo of protein per day. And fats, I like to have a lot of monounsaturated fats, so olive oils, avocados, all of those are very good. Omega-3 fatty acids that we get from either supplement form or from fatty fish that you consume in your diet. And you want to limit the omega-6 fatty acids, which are mainly vegetable oils. Those are highly inflammatory, and we really want to limit those as much as possible. The other good fat you can get from nuts. I really like nuts a lot, especially as a snack. It helps keep you satiated, and again, it's a good source of fat. Finally, supplements. I ask all my patients, for the most part, to take magnesium supplementation. For whatever reason, we don't get magnesium in our diet, and my patients are deficient. I ask them to take somewhere around 600 milligrams usually of magnesium glycinate at night. I also ask my patients to supplement with omega-3 fatty acids somewhere around 3 grams per day. Also, when you get your lab work checked, have your doctor check a 25-hydroxyvitamin D level. All of my patients are low. Again, I'm not sure why, but they're low. So we typically supplement with vitamin D3 and base your supplementation on what your lab values show. Finally, the supplements I recommend, there's a lot of different supplements to help you become more insulin sensitive. The main ones are chromium, alpha lipoic acid, berberine, probably my favorite, kudzu, bergamot, cinnamon. There's just a lot of supplements out there. What I recommend is that you combine several of those supplements like chromium, alpha lipoic acid, berberine, and cinnamon. That's a typical combination. But you can look, the higher quality pharmaceutical grade supplements will all have a glucose control supplement. Okay, that's talk for today. What I want to encourage you to do is change your diet, take supplements, give it 3-4 weeks, preferably 4 weeks, and bring these leptin levels down, bring your insulin levels down to where you're not as resistant as you have been. You'll start to burn fat. Once you start to burn fat, you'll find that it's much easier to keep your weight off. Okay. Again, go to our website, check it out, www.thewelldoc.com. A lot of free information on there. You can also sign up for a free phone interview with me, and we can get to know each other. You can ask me some questions as far as your medical history, and we can see if this is a good fit for you. Okay, start burning fat. Thank you.